And welcome back to OpenLine. Tonight we are talking about how recent COVID-19 legislation could potentially impact Tennesseans with disabilities. And I want to remind you, we would love to hear from you over the next few minutes. We'd love to include you in our discussion this evening. A phone number will be at the bottom of your screen. If you're interested in giving us a call with any comments, questions, or concerns, we would love to hear from you. And I want to bring our guest back, Carol Westlake, Executive Director of the Tennessee Disability Coalition. Carol, right before the break, we were starting to talk about your work with the state legislature, how you're kind of involved in that process, observing what goes on Capitol Hill. And of course, recently that hot topic has been COVID-19. And Governor Lee has signed off on legislation that has limited what schools and health agencies can do as far as COVID restrictions. What was your initial reaction to that? Let's start with that.
Well, we were obviously very disappointed. We actually had some conversations with leadership at the General Assembly and other members of the General Assembly to talk about the fact that we were very concerned about access to education for kids with disabilities. I mean, this last year, we're in our second school year, aren't we? That's really been challenging. And in the very early days in 2020, when schools were shut down, it was hard on all students, I think. I mean, it was a really difficult time. But getting kids back to school was obviously a really important thing. The governor and members of the General Assembly did, I think, a tremendous job last summer on sort of trying to make sure that kids had enrichment to kind of catch up during the school year. I mean, recognizing that being in school is just a really important thing. And, you know, without safe protocols, it's not possible for some kids with disabilities or chronic health care conditions to be able to go to school. And so before the special session was called, we had conversations with members of the General Assembly, contacted the governor's office and said, we just want to be clear here that, you know, you need to think about kids with disabilities and kids with chronic health problems. It could be kids with asthma, frankly, or other kinds of lung conditions. I think people sometimes tend to think about disability in a pretty significant way, do you know, and that all kids with disabilities are in special education, for example. Just not true. There's lots of kids with chronic health problems. I know half a dozen kids who have significant heart conditions, have had multiple heart surgeries in their lives, for example. You know, 15 surgeries before you're 12 years old, and you're really vulnerable to things like infection. I know those kids who wear masks during flu season way pre-COVID, you know, just to protect themselves, for example, among other kinds of things, or kids who sometimes are out for a week during flu season if there's an outbreak in their school. So parents of kids with disabilities and chronic health care problems have really had to face these kinds of issues even pre-COVID, and then you've got a pandemic, right? And so making sure that health and safety protocols are used in schools, and that mask wearing was, you know, pretty universal is really important to having access to school for some kids. I will tell you a story. I know a young woman, well, young girl, I guess. She's about 10, who has some chronic health issues, and she's not been able to go to school at all this year. Because her school was not safe. The alternative they offered her was to go on homebound education, which is kind of what happens with hospital-based kids. That offers 3 hours of instruction a week. And in the first semester this year, she really has only had about 8 hours of instruction total, because there haven't been teachers to send to her home. So she's been out of school because the school can't keep her safe. And so those are the kinds of stories that we hear all the time. To be fair, there are also kids who have chronic health issues and disabilities who might not be able to wear masks themselves. And so we have done a lot of work helping to folks learn other alternatives for keeping safe when that's the case, right? I mean, so you really do have to kind of individualize this. There are some kids with autism, for example, who have huge sensory issues and just would not be able to wear a mask. But there are some actually kind of cool, spacey looking hoods with clear masks, and it kind of zips down, right? And it's a little funny looking, but it protects that individual and it protects the people around them. So there are alternatives that folks can do. So we've been very engaged in this. And then when at the last minute, the General Assembly passed a bill that eliminated mask mandates, and was not going to protect kids, and that in our view violates the Americans with Disabilities Act. It was very disappointing, and more disappointing when the governor signed it. And I understand what a hot political issue it is, and I think that's a shame, because I think it's really a community safety issue. And children with healthcare needs have as much right to go to school as anyone else does, and they have a right to health and safety, just like everybody else does.
So in your opinion, do you think this violates federal law, what passed?
We do think it violates federal law. Interestingly enough, the governor's own legal counsel sent him an email on the way to this bill being passed, telling him that it probably violated federal law. And now we have lawsuits in a couple of the major cities in Tennessee by parents of kids with disabilities. This is not how parents want to spend their time, I promise you. But are feeling they need to do that in order to keep their kids safe. And so there's an injunction in some places because there are judges who are pretty sure that it does violate federal law. It's a little bit, sort of down a rabbit hole probably, but one of the things about the particular bill that passed and that the governor signed into law is that it dictates a single accommodation for kids with disabilities. So if a kid has to be in a place with a mask, the parent has to ask in writing, and the principal has one choice, and that is to put that child in an in-person setting where nobody's within 6 feet of them for more than 15 minutes without a mask on. And the big concern about that is that it's going to segregate kids with disabilities, and we have spent probably the last 40 years trying to include kids with disabilities in their communities instead of forming special schools, special classes, special everything, right? And you don't belong with us, you belong somewhere else. And the idea that we would do that again to create this sort of separate but equal scenario for a school is just not where we ought to be.
It's such a challenging situation. I mean, just with stories I've covered over the last year and a half, I mean, it runs the gamut. You've got parents that feel safer with their kids at home. They feel safer with their kids in school. They feel safer with their kids wearing a mask and not wearing a mask. I mean, is it tough? You can't please everyone, right? I mean, you can't address every issue, I suppose. That's part of the challenge of all this.
You can't. And I think parents really do have a responsibility, and a right to make the best decisions they can make for their child. But that doesn't extend to decisions that negatively affect other people's children. Do you know? I mean, that's really the challenge, I think.
We are going to take a quick break. We'll come back. We'll go to the phones. So give us a call if you're interested in joining this discussion. We will be right back with more Open Line right after this.